Huh. Now see here. What does spikomanometer measure? So what does it measure? It measures BP. It measures blood pressure. It measures blood pressure. It is an instrument. Okay. It is an instrument. Now see here. Which one of the following causes the chikungunya? So what I told you, chikungunya. Vector is mosquitoes. Mosquitoes are bringing chikungunya to our body. But what is the pathogen? It is virus. It is virus. Then what? Chikungunya, malaria, dengue, elephantitis. This everything is caused because of different pathogens. But who is the vector? Common vector in them? Mosquito. Mosquito is carrying bacteria and virus in them. Okay. Okay. Which one? Now see, malaria. Malaria is caused because of protozoa. We know that, plasmodium. But that plasmodium is carried by mosquito. Okay. Now see, which one of the following vitamins is abundant in guava fruits? So which is the vitamin? Vitamin C. Vitamin C. Now see, which one of the following vitamins help in clotting of blood? So which is that vitamin? Vitamin K. Remember, K is always there for clotting blood only. Vitamin. Okay, this much only. Now we will go on a PDF. Okay. Now we will go on a PDF and we will solve more PYQs. Till here you have any doubt? Till here you have any doubt? We were doing this question now. If you have any doubt, please comment below, okay? Okay, chalo. Now we will solve this, okay? Solve this PYQs. Chalo, have a look now. Which of the following diseases are prevented by vaccine? Which of the following diseases are prevented by vaccine? Option 1, tetanus. 2, polio. 3, leprosy. And 4 is pertussis. Pertussis means what? Pertussis means whooping cough, okay? There is another name for pertussis. It is whooping cough, okay? I think so it has one more name, which is kala pani, but this is more prominent, okay? Tetanus, polio, leprosy and pertussis. So what is the answer? Which of the following diseases are prevented by vaccination, injection? There is a vaccine in that. So which of the following diseases are prevented by vaccination? All of them are prevented, right? Because we get vaccine for this also. When we are baby, we get vaccine for polio also, for leprosy also vaccine is available, and for whooping cough also vaccine is available. So what will be the answer? Answer will be all of this, all of this, okay? Chalo. Now what is the next question? Read this question fast. Read this question. Let me check all of your comments. If you have any doubt, please tell me. Now what is given here? Name of the scientist is given, and what you have to do? Who removed that? Okay. Who discovered everything? You have to remove that. Read this. Match the following. Match the following. This is a factual question, okay? That's why I tell you, when they have given this everything, like for example, who discovered the first live cell, who discovered the first dead cell, that you have to everything you have to tell me. That everything you have to remember also. I will ask you. Read fast. I'm giving some time. And have you completed your backlogs? Have you completed your backlogs? See in the this option there is given discovery of insulin. What is insulin? What is insulin? Is diabetes related to insulin? Okay, let me check your comments if you have answered. Your two tabs are not open, that's why. Okay, okay, we'll solve this question. Tell me what is insulin? Where we use insulin? Where we use insulin? Okay, match the following list. Your scientist is given. Name of a scientist is given here, and here what they have discovered or what they have researched, that is given here. They might have removed vaccine, or they might have given theory. Okay, they might have given different uses that we will learn now. Okay, so vaccination for smallpox. Vaccination for smallpox is given by whom? So it is D.E. Jenner. So 4 means for D is option A. I'll write here A, B, and C and D. For D is option 1. I got to know that. Okay. Now see here. F.G. Banting. What does F.G. Banting give? Discovery of insulin. He gave discovery of insulin. So discovery of insulin is A4. A4. Now see in which option you can see 4 and 1. Only in one option. So it's option A. Is option A. Now see here. J. Lister. Who J. Lister gave what? Use of carbolic acid as an antiseptic. As an antiseptic. We have now antiseptics. As carbolic acid as antiseptic. Means he used this chemical as antiseptic. And Louis Pasteur gave them germ theory. Note this down. This is a factual data. Okay. Note this down. Okay, now we'll go on next. Now see here. This is very easy question. Try solving this question. Very easy. Conjunctivitis. Conjunctivitis is the disease of conjunctivitis means what? It is redness of eyes, swelling. So it is a disease of eyes. Dermatitis. See, most of the times when we have the skin diseases, we go to dermatologist. So dermatitis is a disease related to which problem then? By dermatologist you can understand now. If we have skin problem, we go to dermatologist, right? Yes or no? So what will be option for first one? 1. For second one? 3. So you can see. Yes or no? By only 2 options you have done now. See, for the first one, conjunctivitis, yes, that is redness of eyes, swelling of eyes is caused, and that is a, okay, it is caused by this. It is caused by virus only. Okay, then dermatitis, it is caused by, that is a problem to skin. That is a problem to skin. So see here, A, B, C and D. First one you know first. B1 you know 3. So 1 and 3. By only this much you can solve. Yes or no? But remember this gouts, it is of joint pain. Okay, it is joined. And meningitis is for spinal cord. It is for spinal cord. Spinal cord. Okay. Now we will go on next. This everything you have to note. Okay. Which one of the following is not an insect borne disease? Is not an insect borne disease. Now only we learned what is beriberi. Beriberi is deficiency is because of deficiency of vitamin B. Kala azar, housefly, house or sandfly you can say. Then malaria, mosquito, plague also because of what? Tell fast. Plague is caused because of, you might have done history. In history also there was plague. It played a big role. Because of what? Tell me fast. It is caused by bacteria, but who is the vector? Who is the vector of plague? Mouse is the vector of plague, no? Mosquito. You can write sand. Okay. Understood? Okay. And this is vitamin B. Okay. This was easiest question. Okay. See this. Consider the following statements. Read this statement fast. Read the statements. Cigarette smoking exposes a person to benzene. Cigarette smoking exposes a person to benzene. Benzene is known as carcinogen. What you have to tell? Consider the statement. You have to tell, are the both statement right, or which of the statement is right? Fast. Okay, let me tell you this. Listen now. Scientific name of benzene is carcinogen. Okay, the scientific name of benzene is carcinogen. You have to remember this. Note this down. This is a factual data. Okay, cigarette smoking exposes a person to benzene. Yes, this is right. A person who is habitual of cigarette takes approximately 2 milligram benzene inside. Benzene intake. This statement, both the statements were correct. Both 1 and 2 are considered because cigarette smoking exposes a person to benzene. Yes, it is right, because a person who is habitual of cigarette takes approximately 2 milligram of cigarette, benzene means, and benzene is known as carcinogen. This is also right. Carcinogen. Benzene is known as carcinogen is right. You have to now see here. A person working in textile factories such as carpet weavers are exposed to which of the following occupational diseases? Easy question. A person, the persons working in textile factories, the person working in textile factories such as carpet weavers are exposed to which of the following occupational diseases? Okay, see here. Red, yes or no? The person who is working in textile factories such as carpet weavers are exposed to which of the following occupational diseases? Is it asthma and tuberculosis, asbestosis, silicosis, or sclerosis? Okay. There are many more questions. Okay, we need to speed up now. Next, they are easy only. These are some new questions. That's why it is taking time. Okay, now listen here. The person working in textile factories such as carpet weavers are exposed to which of the following occupational diseases? Occupational diseases. Now, for example, you might have seen factories. Okay, if you have not seen, you see, go it on Google and see it. You can search it, or on National Geography. There are many means there are many shows. They show you factories. So there is lots of suffocation in the factories. See, you might have never seen factory in an open space. There is lots of suffocation in factories, and there is only this much little space where there are exhaust fan. um they have fitted. Okay, other than that, there is no like there is no air or outer nature thing in the factories. Okay, okay, and there is lots of different chemicals, polluted air in the factories. So what will be the disease caused in the factories? See, I will tell you this too, then you can see. Asthma and tuberculosis. Asthma and tuberculosis. Asthma, you know that breathing problem. Asthma means what? Breathing problem. They are, for example, a person having asthma is going for a trekking, and there is an elevation. There is an elevation. Then he will of course get suffocated. Suffocated. So what is asthma? Asthma is a breathing problem, and tuberculosis. Tuberculosis is what? TB, cough. Yes. Okay. So answer is B. Answer is B. Note this down fast. I'll drink water till that time. Okay. Now see here. We got to know that this we get from factories. But this asbestosis and this silicosis are same diseases. They are lung disorders. Why they are caused? Why they are caused? Because of inhaling bad or polluted air, you can say, dust, you can say, for long period of time. Okay, what is siderosis? It is a brain disorder. Okay, it is a brain disorder. Note this down, everyone. Now we will go on next. Learn now. This is easy question. Okay, we have done this before. Dim vision in the evening and night results from the deficiency of which of the vitamin? I told you, night blindness. So vitamin A. Yes or no? Vitamin A is the answer. Now we will go a bit faster because many questions are remaining. Malaria in the human body is caused by which one of the following organisms? So malaria is caused by plasmodium. Plasmodium is what? Plasmodium is what? Plasmodium is a give this. I have taught you in this in the previous lecture. Answer this question fast. Answer my question. Malaria is caused because of what? Answer my question. I will check your comments, okay? And what we discussed before this, that TB can be spreaded through air also. Remember this also. If a person is sneaking in the public who has TB, then that TB can get spreaded, okay? I told you that it is caused because of plasmodium. Plasmodium is a pathogen, yes. But what is plasmodium then? Plasmodium is a protozoan. Okay, plasmodium is a protozoan. Okay, let me check who has answered this question. Plasmodium is a protozoa. Okay. Okay, Uday, good. You're answering. Good, good, good. Means you have revised. You can answer these questions. Okay, good. Keep it up. Okay, we'll go on the next. Note something. If you don't know, you note it down. Okay. Chalo. Which one of the following diseases is caused by virus? Which of the following diseases is caused by virus? Tuberculosis, typhoid, influenza, and diphtheria. So what is caused by virus? What is caused by virus? Influenza. Okay. Note this down. Okay. Now see, this now only I taught you. Now only I taught you na this. So vitamin A is known as what? Vitamin A is known as retinol. Right here like this. A, B, C, D. Vitamin A is known as retinol. Vitamin B1 is known as thiamine. Check the options. Yes, you got the option. Vitamin C is known as ascorbic acid. Vitamin E is known as tocopherol. Vitamin E is known as tocopherol. Vitamin B1 is known as thiamine. Okay. Which one of the following is considered as the drug of last resort for human beings? When this prefix suffix comes na like this, that time you have to understand that it is antibiotics. Okay, it is an antibiotic. It is a antibiotic. Silin comes that time. Read the question. Which one of the following is considered as the drug of last resort for human beings? Which one of the following is considered as the drug of last resort for human beings? Is it penicillin, tetracycline, chlora, chloramphenicol, and streptomycin. Tell fast. Okay, fast. I told you this. When it is like this, you have to understand that it is antibiotic related to bacteria only, because antibiotic kills bacteria cell wall. It directly attacks on the cell wall of bacteria. Okay, so what will be the answer here? This, these two are not there only. What is the answer? Chloramphenicol. What is the answer? Note this down. Chloramphenicol. It is considered as the last resort for human beings. Okay. Now mark this. Match the following: medical products and source. Medical products and source. Fast. Medical products and source. Quinine, plants are given. Plants are given, right? Plants are given. So quinine we get from chicona bark. Penicillin is penicillin is very famous. You should know at least penicillin. Penicillin you should know. Tetracycline. Tetracycline we get from, now see here, quinine we know that it is third option. So check where, only by one option also you can do it. Check where is 3, A, for A where is 3, for this. So such a easy elimination, such a easy elimination. So for morphine, what is for morphine? Poppy plant. Penicillin, for penicillin, what is for penicillin? Oh, sorry, we have done this wrong. Sorry. I'm extremely sorry. Not by one option, you can do by two options. Okay. So see, in option A and B only there is the answer. Only you should know that morphine has which source. Morphine has which source. See, here, I'll only tell. We know that quinine is from chicona plant, bark, okay? And morphine is from poppy plant. So 3 and 1. Now see in which option there is 3 and 1. Yes, C option. C option. So penicillin we get from fungus, yes. And tetracycline we get from bacterium. Yes or no? Okay. Now check this. Check this. Now only we have done this. Yesterday also we did this. Anopheles bacteria. Anopheles bacteria carries what? Carries what? Carries what? So where is A3? Yes, in the A option and D option. So these options are eliminated. Sandfly. Okay, we know that Culex mosquito also. Sandfly. Sandfly carries what? Tell fast. Let me check your comments first. Good, Uday. You are giving answers good. Sandfly carries what? Now I told you na. We did this. Sandfly, Kala Azhar. Sandfly, female sandfly. So one, D1. So where is D1? Okay. They have given same like this. Now Culex mosquito. Culex mosquito carries what? Culex mosquito. Okay. Culex mosquito. X-ray we did this now. Yes or no? Okay, let me simplify for you this. Dengue is known as yellow fever. We know that. Yes or no? Okay. So this is called as yellow fever mosquito also. Mosquito. Yellow fever mosquito also. So C will be 2. C will be 2. So where is C2? Option D. What will be the answer? Option D. Culex mosquito filaria. Filaria means what? Elephantitis. Okay. Elephantitis. You have to remember this name also. Okay. Primary source of vitamin D for human beings is sun. We know that from sunlight only we get primary source of vitamin D is sunlight. Okay, check this. Anemia is a common health problem, especially in women. Which one of the following deficiencies is most frequently responsible for anemia in India? Is it calcium, iron, iodine, or zinc? So, what will be the answer? Iron pigment. Yes or no? Yes. Anthrax is a disease of human and cattle with a potential for biological warfare. It is caused by fast. It is caused by. You can see the screen properly. I can see here blur. Please comment. Anthrax is a disease of human. You can see screen properly. Yes or no? I can see blur. That's why I'm asking. Anthrax is a disease caused a disease of human and cattle with a potential for biological warfare. It is caused because of anthrax is a bacterium. It is caused because of bacterium. Okay. Note there's some factual points you need to note. From which one of the among the following diseases vaccine is not yet available? Easy question. Vaccine is not yet available. For tetanus, we saw there is a vaccine. For which vaccine is not available? For this, everyone's vaccine is available. Then which is the common disease caused by mosquito that vaccine is not available? Vaccine is not available for malaria. Vaccine is not available for malaria. Okay, check this now. Quinine is a drug used in the treatment of malaria from which part of the plant it is obtained? It is obtained from bark. It is obtained from bark. Okay. See now here. Iron from calcium. See, calcium, milk and eggs. Okay. Potassium, palak. Yes, potassium is means B. Then iron. Iron we get from what? Banana. Iodine. Iodine we get from iodized common salt. Match the following. Calcium we get from, yes, milk. So for D, there is 4. Yes. Iodine we get from, iodine we get from ionized salt. So what will be the answer? Potassium we get from, see, calcium we get from milk and eggs. Yes. Iodine we get from iodized salt. 3 and 4. Answer number A. Answer A. Okay. And this iron we get from palak and potassium we get from banana and dates. Okay. Now see here, iodine is necessary for thyroid gland to make adrenaline. No, this is a hormone. This is a wrong statement. Iodine deficiency leads to goiter in human beings. Yes, goiter means thyroid. Yes. Iodine is secreted by pancreas and help in regulating cholesterol level. Yes, both are correct. 2 and 3 are correct. Which consider the following. 1 and 2. Okay. 1 and 2. Check this now. Mosquito can be a vector of the following diseases except yellow fever. Yes, yellow fever, dengue fever and yellow fever is called as Kala Azar. Kala Azar is caused by sandfly, female. Okay. Check this now. A deficiency of which of the following minerals is most likely to lead to the immunodeficiency? Immunodeficiency. Zinc. I told you na. Zinc. Note this down everything. Okay. Insects that can transmit diseases to humans are referred to as insects that transmit. I told you na which vector and we say na. So it is known as vector. Pathogen is a different thing and vector is a different thing. Always remember, okay? The insect or whatever is causing us disease, carrying a disease, carrying a pathogen to a body, that is called as vector, okay? Which of the following diseases are transmitted from one person to the another? From one person to the another. Yes, AIDS is transmitted. Yes. Hepatitis is transmitted. So what will be the answer? Select the correct using the code. AIDS. Yes, AIDS is transmitted, right? Yes, if for example blood gets exchanged or there is a sexual contact, then it is transmitted. Yes. Yes or no? Read the question again. Which of the following diseases are transmitted from one person to another? AIDS, cirrhosis, hepatitis B, syphilis. AIDS is transmitted. Yes, this AIDS is also transmitted. Hepatitis B is also transmitted. This is not transmitted. Syphilis is also transmitted. Check the options. 2, 3, 4. No, 2 is not. 1, 2. No. Oh, option number B. Option B. Sometimes we check here, but we don't get the options, right? Now see here, which one of the following elements, ions, is essential in small quantities for the development of healthy teeth, but causes molting of the teeth if consumed in higher quantities? Answer is fluoride. Now we saw, no? Which one of the following is not correct about Down syndrome? It is a genetic disorder. Affected individual has. Which of the following is not correct? Affected individual has early aging. Yes, it is correct. Then it has poor tongue with open mouth. Yes, this is also correct. It person affected has mental retardation. Yes, all are correct. What is wrong in this then? This is correct, not correct. Everything is correct. Then too, I'll check this question, but I think everything is correct. It is a genetic disorder. Yes, it is a affected individual has early aging. Yes, they has lifespan of like 21 to 23 years. Then affected person has mental retardation. Yes, affected person has for a tongue and open mouth. Yes, they have, and they have a small round shaped this face. Dog bite can cause rabies. Which among the following other animals causes rabies? Yes, it is bat. Bat, dog, then fox causes rabies. Okay, fox causes rabies. Keep this in mind, everyone. Keep this in mind. Okay, chalo. Now next, to suspect HIV/AIDS in a young individual, which one of the among the following symptoms is mostly associated with? Is mostly associated with. So what are the options? Long-standing jaundice and chronic liver disease, severe anemia, chronic diarrhea, and severe persistent headache. Diarrhea. Chronic diarrhea. What is meant by chronic? Chronic diseases means what? What is meant by chronic diseases? Something, some diseases affected for long time, like cancer, elephantitis, and all that. Okay, some diseases which are affected for long time in the human beings. Okay, the anti-malarial drug quinine is made from a plant. Now in the previous questions we saw, yes or no? Chincona. Okay. See the next one. Which one among the following is the generic name of the casual organism elephantitis? Filaria is the name. Yes or no? Yes or no? Okay, now see here. Which one of the following diseases in humans can spread through air? Now only I told you tuberculosis. Tuberculosis is spreaded through air. AIDS is spreaded only through blood or sexual contact. Goiter is deficiency of iodine, and dengue vector is mosquito. Wait, let me write here. Physical or blood. Here goiter means deficiency of iodine, thyroid, tuberculosis, air, sneeze, cough. cough, dengue, mosquito. Yes or no? Mosquito. Note this down, everyone, okay? Now see here. Cobalt is associated with which vitamin? Vitamin B12. Vitamin B12. This everything, growth hormone and everything, this we will learn in hormones, okay? This we will learn in hormones. Okay. Measles is a disease caused by virus. Okay. Only few questions are remaining. We will do them. Chalo. The mandate of the scheme entitled Directly Observed Treatment, short course, DOTS, launched by whom is World Health Organization. World Health Organization, its headquarter is in Geneva. Headquarter is in Geneva, Switzerland. Switzerland. Who is ensure that patients complete their course of drugs. Patient complete. Most of people have bad habit of not completing their course, so they ensure that people are completing it. Okay. See now, penicillin inhibits synthesis of bacterial cell wall. Bacterial cell wall. Yes. Okay. Check this now. Most antibiotics target bacterial parasites, interfering with various factors of growth of metabolism, such as synthesis of the cell wall. Yes, first is correct. Bacterial protein synthesis. Yes, synthesis of nuclear membrane. Yes. Okay. Now check this. Vitamin B12 deficiency causes pernicious anemia. Animals cannot synthesize vitamin B12. Human must obtain all their vitamin B12 from their diet. The complexing metal ion in vitamin B12 is what? Cobalt ion. Each question is repeated but in a different language. Very easy. This also we have done. Vitamin A. Vitamin A causes what? Which of the following pairs of vitamin and diseases are correctly matched? This is wrong. Vitamin B1, very correct. Vitamin C is scurvy, correct. 2 and 3 only. Okay? 2 and 3 only. Dengue virus is known to cause low platelets count in blood of patient by what? Interfering the process of the platelets production in bone marrow. Yes. Interfecting endothelial cells. Yes. Binding with platelets. Yes. Accumulating platelets in intestine. No, it does not go in intestine. So what will be the answer? 1, 2 and 3. 1, 2 and 3. Okay. Okay. Chalo. Next. The HIV virus weakens the immunity of a person because it destroys what? It destroys white blood cells. So white blood cells are called as lymphocytes. White blood cells. These are red blood cells. Platelets are known as thrombocytes. Okay. Now see, a deficiency of fluoride leads to which one of the following? Yes, tooth caries. Means what? Cavities in the teeth. Cavities in the teeth. Yes or no? See here. Bleeding of gums, falling of teeth, fragile bones, and delayed wound healing occur due to the deficiency of which one of the vitamins? Bleeding gums, falling teeth. Caused because of what? Bleeding gum. When bleeding gum comes, you have to directly go to vitamin C only, because scurvy, you know. Okay, which one of the following organism is responsible for sleeping sickness? Yesterday only we saw trypanosoma. Yes or no? Trypanosoma. Which one of the following is not an epidemic disease? Epidemic means what? It gets spreaded in small areas. It gets spreaded in small areas. So this is all. So elephantitis is not an epidemic disease. Okay. This is also called as filaria. Filariasis. Okay. Finish. Okay, chalo. Now everyone revise this, everything. Okay, revise, and whatever notes I have given you in this, revise it, everything. Okay, and have a good day. And please keep on revising it. I know Diwali is coming and you want to go outside. Yes, you can go, but you maintain your consistency. Like you give 10 minutes to biology, and it will give you good marks in GS. Okay. Okay, so have a good day, everyone. Now we will end our class. Okay.